Chronic suprative otitis media. Chief complaint number 1, ear discharge, decrease hearing. Number 3, moderate to profuse mucoid discharge from ear. Number 4, ear pain. Investigation number 1, culture and sensitivity of discharge. Number 2, CT scan temporal bone. Treatment number 1, capsule amoxicillin 500 mg TDS PO into 7 days. Number 2, tablet cetirizine 10 mg POHS into 7 days. Tablet Revi 20 mg into BD into 7 days. Number 4, ear drop Ocopol D 2 drops TDS into 7 days. Tablet D-pen 1 tablet BD into 3 days. Then SOS. Advice for patient number 1, avoid swimming. Number 2, ear plug during bathing or washing. Thanks and welcome our YouTube channel.